Jonathan Ball joins us from Nottingham in the UK. He is a professor of virology at the University of Nottingham. Jonathan, thank you so much indeed. How much do you know about this virus?
It's a very rapidly changing picture. We know that coronaviruses have been infecting humans for thousands of years. There's usually 4 viruses that commonly circulate in humans, but they generally don't cause severe disease. But over the past few decades, we've seen the emergence of coronaviruses from animal reservoirs that have caused outbreaks which have resulted in much more serious disease, dating back to SARS in the start of 2000s. Which infected about 8,000 people and 800 people died, and ongoing infections in the Arabian Peninsula of MERS coronavirus, which originated from camels. So these things have been happening over the past couple of decades, and what we're seeing in China is really an extension of those coronaviruses presumably spilling over from an animal reservoir, and we don't yet know what that is.
Yeah, what do we know about the human-to-human transmission? Are we talking about breathing on someone? Are we talking about shaking someone's hand and possibly getting their sweat on your hand? What could it possibly be?
That's a very good question. So at the moment, there seems to be some human-to-human transmission. Before the weekend, we were led to believe that there was no obvious evidence of transmission in a healthcare setting. For example, people looking after somebody infected with one of these coronaviruses, we expect them to be most at risk because they're dealing with the most sick people who are generally producing more virus, and they're constantly exposed to the virus. But over the past few hours, we've learned there are rumours that some healthcare workers are being infected. So clearly there is some human-to-human transmission. And how that transmits is difficult to absolutely pinpoint. It is a virus that is spread through breathing, so it's on respiratory droplets, and you can inhale those droplets directly, or indeed that can lead to contaminated surfaces where you might potentially pick up the virus. So it's certainly transmitted through the breathing route, but that could be both inhalation as well as touching and coming into contact with contaminated surfaces.
Jonathan, do you have any information about the treatment that those who have died had received? In other words, is it something that normal medicines cannot cure, or is it possible that just that the patients weren't given treatment quickly enough?
It's unfortunately with these sorts of viruses there aren't any specific antiviral treatments, and so for the most severely infected individuals, people with pneumonia, they're looked after in hospital, they're supported, their breathing is helped. And indeed, one of the things that you do is a process called intubation, where you insert a pipe into the into the airway and allow the patient to breathe. And again, that's quite a risky procedure for those roundabout. So essentially, individuals most severely infected will be getting supported in intensive care units, having their breathing supported, and hope that they themselves, their own immune system fights the virus off.
The head of China's National Health Commission says he believes that actually the spread of the virus can be contained through extra vigilance. But we've got the Chinese New Year coming up. You've got 400 to 500 million who are going to be travelling around the country. And presumably, if they're infected, they're not all going to be screened, and they could potentially take it to any part of the nation and then, as we've already seen, take it abroad. How concerned are you about this period of travel that's coming up?
I think one of the main concerning factors is the apparent increase in the numbers of cases that have been reported. So before the weekend, we were looking at tens of cases. Now we're looking at just over 200 cases. So either there was a lot of hidden infection, which I think there was, but also it may be that this virus is spreading amongst humans slightly better than we thought. And therefore, anything that involves movement of people who potentially are infected, it is a risky business. And we have to continue to be careful to ensure that screening is adequate, particularly in China, where we know the focus of the infection is centred. And it's only through vigilance, through monitoring, that we're going to bring this outbreak to an end.
If we were to look at the SARS outbreak in the 2000s, can we learn anything in terms of potentially finding a cure for this particular coronavirus? In other words, how long it might take, who would work on it, what they need information they need before they can find a potential cure?
I think in terms of a potential cure, the pathway to developing cures for viruses can be a lengthy thing. So I don't think realistically we can see a specific cure being developed. But I think one of the burning questions is, firstly, how the virus is transmitting. Is it being transmitted easily between people? But also, where did the virus come from? Because if it is an animal reservoir that itself is carrying virus and coming into contact with humans regularly, then that makes it a difficult thing to control. If, however, it was a single infected animal that was introduced into the Chinese market that spread amongst the animals that were being kept there, and then those viruses spilt over into humans, then that's easier scenario to deal with. So at the moment, we've just got too many unknowns, but clearly this virus is on the increase.
Jonathan, a personal question. Are you scared of this?
I think it's concerning. I'm not scared at the moment. We have good health infrastructures in many parts of the world. I think the areas where there are not so well established health infrastructures are the places that potentially could be under more threat.
Thank you so much, Jonathan. Really appreciate it. Jonathan Ball from the University of Nottingham.